Hi, it's Dr. Richard Downs and Dr. Joseph Zelk, and we're going to be showing you how to fit a CPAP. And this is the first one I've gotten, and then Joe's going to lead me through it, and then there'll be a training session for everyone. So thanks for being online with us, Joe. Would you like to introduce what we're doing?
Sure. So there's going to be a number of cases where when your office refers to us for telemedicine, if the patient is severe enough or would like to try a trial of auto CPAP, that's still considered the gold standard. So a couple of ways to make it more efficient and more convenient for patients is we can actually prescribe what's called auto titrating CPAP. Instead of making the patient wait several months to get into a sleep laboratory and have a technician adjust their specific individual pressure, we can capture that more conveniently with the actual CPAP unit. So the auto CPAP typically costs exactly the same as a straight CPAP pressure with only one CPAP setting, but it gives us more latitude to find the pressure that's individual to that patient remotely. So if we were to prescribe CPAP, we're typically going to do it for auto CPAP with a general range of about 5 as the lowest pressure, and they can go as high as 20. I typically like to tighten that down to about 5 to 15 or 5 to 12. Because the problem is patients will typically feel a little bit claustrophobic if the pressure ramps up to a high enough pressure that's uncomfortable. So you want to avoid the patient having an experience where they're waking up with a very high pressure. Now, why would that happen? Well, typically if the CPAP mask isn't sealing well initially, the machine will continue to find pressure constantly by blowing higher and higher pressures, and that's going to be counterproductive. So we typically want a smaller general range initially, give the patient a few weeks to get slowly acclimated to it. So Dr. Downs has just obtained an auto CPAP. We prefer the Resmed brand. It's the one that's the safest. It doesn't have the recall like the Respironics. So the Resmed AutoSense 10 and AutoSense 11 are the most recent devices. Right now, Dr. Downs got this at cpap.com with one of our prescriptions from our sleep doctor. On our panel, and he prescribed for auto CPAP with mask of preference. There's many masks out there. We're going to demonstrate one specific style today, but you can see right now that's the AutoSense 10, and then you can pop off the reservoir for the distilled water, and it just presses in firmly till it's fully seated. And you never want to travel with water in your container, so always empty out the water before you travel. And the packaging conveniently has it so that you travel with your machine separated from your reservoir. And it's important to have distilled water because, we can't really fully trust what's in tap water. So we don't want to risk, putting bacteria or other contaminants into your pulmonary tract. So distilled water is great. And typically for comfortable CPAP, you want a humidity, and that's why the water reservoir is there to moisturize the air. If you have a cooler environment, you probably want to dial up the heating element on there. They come standard at a medium heat of 4. I suggest typically 6 or 7. And the more warm the air is, the typically more comfortable it is, and the more moisture the air will contain. Because remember, you're pressurizing your airway, and that can dry out your nasal passages and be uncomfortable. So if you're drying it out, then it's hard to keep the mouth closed, okay? So we're going to start off with an auto CPAP with a general range. We've already adjusted it. If you show them the screen there, Dr. Downs, it'll show you initially that you can actually, when you press the button there, maybe do the start button there on the top. You just push and hold down. You can see that it's highlighting one of the boxes there. And if you click the little cylinder, it will select that. Yep. And then if you dial it up one more time to the top one there and you click it, you'll see that it shows you what it's starting off with. And it says right there, it's starting off on an auto setting. It's got a certain amount of time for ramp. It has a mask selection. It typically defaults to full face mask, so you want to change that to a nasal mask or nasal pillow if you don't have a full face mask. And it will also allow for you to extend the amount of ramp time. So what is ramp? Ramp means that the pressure starts low, so it's less uncomfortable. And over a period of time, it'll gently ramp up to the treatment pressures, which are a bit less comfortable. Your sleeping brain technically should be able to tolerate that, but your awake brain might find it's a little uncomfortable. So if it takes you 10, 15, 20 minutes to fall asleep, you'll typically set that ramp pressure at a low pressure of 5 for that 5, 10, 15, 20 minutes that it's going to take you to fall asleep. And then it'll start going into its range. So the way auto CPAP works is it looks at your average of every 3 breaths. So if you're falling asleep and you're in lighter sleep, you might need less pressure. So every 3 breaths, the pressure sensor will look at that pressure. And if it's flattened, it means you have area restriction. So it's looking for a nice S wave there. And it'll incrementally increase that pressure, typically 0.2 centimeters of water pressure, and it'll gradually go up and down throughout the night, depending on what you need. It'll find your individual pressure, and it'll do that for every 3 breaths on average. And over a few weeks, we can find what your average pressure is, and it's going to look for average or your mean pressure and your 90% pressure. So meaning your average might be that when you're in side sleep, light sleep, medium sleep is a lower pressure and your average, but maybe when you're in REM sleep or on your back, you might need to graduate to a higher pressure. So 90% of the time, you're going to fall below a certain pressure. And that's typically where we would set an auto CPAP pressure out, is at your 90%. But just to give you a little feedback, is there's an average pressure, our mean pressure, and a 90% of the time pressure. So just so that you understand those 2 metrics that we're looking for. So Dr. Downs is going to demonstrate how to apply the DreamWear mask by Respironics. Respironics has a great set of masks, even though we're not using Respironics machines, we're using the masks, as they're still very effective. Also, let's demonstrate this. You pop in the tubing, and you're going to take the nasal pillow or nasal mask, rest against the nostrils, and bring the strap over the back of the head here. So grab the strap and then touch the nostrils. There you go. Nostrils, slide the strap to the back of the head, and the tubing should be on the top of the head. So the reason why they put the tubing with the connection on top of the head, that tubing can go behind you over your pillow. So when you're side sleeping and moving side to side, the tubing is out of the way. If the tubing's going downward, you can end up underneath your arm, or you can kind of yank it off. So what's nice about this swivel on the top of the head is it's out of the way. It's not in your way when you're turning side to side. Now, is the machine on right now, Dr. Downs?
Yes. I'm going to
So
use the
Good. So if the machine is on right now, you can see if you open the mouth, it kind of will make some noise.
It isn't pushing out pressure right now, so I can turn that on to
Yeah.
Okay, so
Go ahead and just hit the on button.
it's ramp time or home. All right.
So once you hit the on button, it should automatically start to blow pressure, and it's going to be at that low ramp pressure. There you go. So it's set at a 4 right now. So his lowest starting pressure is 4. Now, almost no one is treated with a 4. In the milder cases, you might see a 5 or a 6 or a 7. In the moderate cases, you might see more of an average of a 7, 8, 9. Once it goes past 15 of CPAP, it can be pretty uncomfortable with a nasal mask, so some of those people might need to use a full face mask. Nasal pillows are very hard to tolerate with a pressure above 15. Once you go above 15, you get a lot less compliance with CPAP, because that's a more uncomfortable pressure to breathe against. So right now, Dr. Downs is gently keeping his mouth closed and breathing through the nostrils, but sometimes if you open the mouth, it'll leak out of the mouth. So we encourage you to consider versus mouth tape, which people have talked about with the James Nestor book. This is actually more effective. This is called the iBreath. It's a little obturator that goes underneath the lips, in front of the teeth, with a little tubing that goes on the top of the tongue. So when you suck on it, it pulls the tongue on the roof of the mouth. So it does 2 things. It keeps the tongue in a good position and keeps your mouth from leaking. And so when you wear a nasal mask, you're much less likely to get that mouth breathing and that dry mouth from a nasal pillow. So we tend to suggest folks to consider this if you have a nasal mask, the patient's complaining about dry mouth or something like that. This is also great to be used over a dental appliance, because if the vertical is pretty high on the dental appliance, having this little eye breath over that keeps you from mouth breathing and encourages nasal breathing. So that could be used as a combination for both the nasal mask as well as the dental appliance there. You can see it just kind of rests over the lips, underneath the underneath the lips, over the teeth. And it's a really pliable, easy to use little interface here. This is also great for people who are wearing their Invisalign and are, we want them to encourage better tongue posture and avoid mouth breathing. This can be used over someone who's using Candid Pro or Invisalign aligners to just have a better tongue position and avoid mouth breathing.
I'm turning it off now.
Yeah.
So
So that's one example of nasal mask, and that's called the Dreamwear, and it's actually a preferred mask because it doesn't obstruct the visual field. The nasal rests against the nostrils instead of pushing against the face like this, so it doesn't leave as many marks on the face, which a lot of women don't like. And it keeps the tubing out of your way as you're turning side to side. So it encourages side sleep.
You need to make sure that the tubing comes off the top of your head rather than.
Yeah, so the strap should be grabbed and pulled to the back of your head.
Right, exactly. So that's how it looks. So this part here and this nose, the nasal thing is in front. This adjustable strap is in the back, and this is at the top.
Correct.
And you can reverse this, and then you got the hose coming out the back, which is not what we want. I made that mistake starting out here today.
Easy to make that mistake. And there's plenty of YouTubes showing you fitting procedures for different styles of masks. So if you have a patient who wants to try different masks out, they can go onto YouTube and type in the name of that mask, and they'll show you how to use it. Now, it's important to know that there's no one correct mask for every particular person. Right. So you try to give someone options that are less invasive, but they may have to go out and buy a couple different styles and try it out for themselves. Everyone's a little different.
Yeah. Well, that's great.
And typically, once you start using it, we want the patient to meet back up with us about 2 to 3 weeks after they start the CPAP therapy. So then we can review in the on the CPAP device. It'll tell you in the morning your average AHI. It's an estimate of what your apnea-hypopnea index is on the top. So hopefully we're going to get you down below 5 AHI. If you have a mask leakage, you're always going to leak a little bit of air off so you don't rebreathe carbon dioxide. So if your mask leakage is about 20 to 30 liters per minute, then that's what we want. We want that sort of amount of leakage there. We want some leakage, but not a massive amount of leakage. And then we're going to look at the usage time. So how many hours per night are you using the CPAP? And it'll tell you your average hours per night. So we want to try to shoot for the whole night, but the minimum would be 4 hours if the patient's trying to reach an insurance compliance. But really, we want you to, if you're sleeping 7 hours, you should be using it for 7 hours.
Yeah. So we should check back in a week, Joe, and see how I'm doing with this device. And you can do another recording on compliance issues and any kind of things that need to be adjusted. So thank you.
Sounds great.
Thank you.
Sounds great. Well, thanks for attending, guys.